Hey everyone, welcome to the very first episode for 2021 of Healthzone with Gilbert Cheah. I'm Gilbert Cheah, I'm the editor of Healthzone Singapore, a Facebook page that deals with health and wellness issues specifically curated from a Singapore and regional perspective. We wish you all a very happy and healthy new year ahead. And it seems appropriate that for the first show of the new year, we talk about something that has been long awaited for and anticipated, but which still has so much misinformation and confusion about. And that is the subject of the COVID-19 vaccines, which will soon be available to Singaporeans and long-term residents here. Vaccinations for healthcare workers started on 30th December 2020, while vaccinations for the elderly, those aged 70 and above, will begin next month in February. As of today, the coronavirus has spread to some 218 countries and territories, with 84 million cases and over 1.8 million deaths. And out of all of those countries, only 29 have received one of the 7 vaccines available for public use and started administering them. And luckily for us, Singapore is one of those countries. Now, for a small country like Singapore to get vaccines so quickly was no accident. As early as April last year, a therapeutics and vaccines expert panel was set up here to source for vaccines from around the world. The panel, which comprised of 18 scientists and clinicians from hospitals, A-Star and the private sector, conducted an extensive study of 35 promising vaccines to screen them for safety and efficacy before deciding which to get for Singapore. And so far, 3 different vaccines have been purchased from Moderna, Pfizer-BioNTech and Sinovac. But only the Pfizer-BioNTech vaccine has gotten approval for use here by the Health Sciences Authority. The other vaccines are still being reviewed by HSA. Singapore's Prime Minister Lee Hsien Loong has said that the government placed multiple bets to sign advance purchase agreements and make early payments for the most promising vaccine candidates. More than $1 billion Singapore dollars has been set aside for these efforts. And in addition, the government also attracted a few renowned pharmaceutical companies to set up manufacturing capabilities here and also supported local companies to develop a vaccine. This not only gave Singapore scientists and researchers the opportunity to do cutting-edge work, but also ensured that we would not be severely affected if there was a disruption in the global supply chain. The Prime Minister said that this way we built up a diversified portfolio of options to ensure that Singapore would be near the front of the queue for vaccines and not the last in line. Now, with one vaccine approved here and more on their way, the key is to get as many people here vaccinated as possible. Now that we have some background on the vaccine situation, I wanted to answer some common questions about the vaccines and help clarify and clear up common misconceptions. First question, what does the vaccine do? Now, the vaccine will prevent you from contracting COVID-19 if you get exposed to it. Once your body gets the vaccine and learns to recognize and destroy the virus, you are protected, which is what having immunity means. The COVID-19 vaccines purchased for use in Singapore have been shown to be highly effective at preventing COVID-19 with an efficacy of over 95%. So even if people get infected, their chances of getting sick are much, much lower, and this has a big, important effect on the entire country. It means far fewer people will be admitted to hospitals and far fewer people will get seriously ill or die. And this is so important because if the hospitals are filled with COVID patients, which is the case in most other countries which is suffering from COVID right now, the US and many European countries, for example, people with other illnesses and needs cannot get admitted and cannot receive medical care because the hospital and medical systems are overwhelmed. The vaccines make a difference, therefore, not just in your own personal health, but also play a big role in the country's public health situation. Question 2, very commonly asked and very important. Are the vaccines safe? Weren't they rushed out and doesn't this make it risky? Now, I will specifically address the Pfizer-BioNTech vaccine as that is the one that has gotten HSA approval. Now, although this vaccine was produced in the US under the Operation Warp Speed program, there were no shortcuts in the clinical processes. The safety and testing protocols were all in place as usual, and it was the red tape and government processes that was sped up. So what they did was, instead of taking the different steps one after the other sequentially, they took the steps simultaneously, which was really an ingenious way to shorten the time needed to get a vaccine developed, tested, and approved. And what's important to note here is that there were some 150 clinical trials held all over the world in different countries for this vaccine, with over 43,000 volunteers testing this vaccine. Those volunteers were aged between 16 to 85. They came from different races, different genders and backgrounds, and they were randomly given either the vaccine or a placebo to test for its safety, side effects, and efficacy. Not only has the Pfizer vaccine been scrutinized and studied by American regulatory authorities such as the FDA, the Food and Drug Administration, the vaccine also had to undergo rigorous review by Singapore's own Health Sciences Authority. And the HSA used international scientific standards to evaluate the data for themselves to make sure that the vaccine met the required safety, efficacy, and quality standards, and that the benefits of the vaccine outweigh the known risks. Question 3. What about the people who had allergic reactions to the vaccines? What's that all about? Okay, so far, out of the over 12 million people who have been vaccinated, there have been about 10 to 15 people who have had severe allergic reactions. And almost all of those who had allergic reactions, the reaction is known as anaphylaxis, were people who knew they had strong allergies and had a history of allergic reactions. They had such severe reactions, they even carried around an EpiPen, which administers medication in emergencies to treat very serious allergic reactions. So their allergic reaction was not really a surprise. And only one person had an allergic reaction who previously did not have a history of allergies, and she was treated and released. Now, it's important to state this. If you have a medical history of allergies to certain foods, pets, insect bites, or other substances, talk to your doctor about whether you should get the vaccine. If you don't have allergies, don't worry. With 10 allergic reactions out of 12 million vaccinations, you literally have a higher chance of being struck by lightning. And anaphylactic allergic reactions can be quickly treated with antihistamines and adrenaline injectors, so there's no serious danger. And in Singapore, as part of the precaution of the vaccine protocol, they will keep you there for 30 minutes after you get the vaccine injection to monitor for any possible reactions. Question 4. What about side effects? Now, every medical treatment, including taking over-the-counter medications, can have side effects which will vary among different people. In the case of the vaccine, the side effects are mild and temporary, and is proof actually that the vaccine is doing its job in training your immune system to recognize and fight the virus. Think of it as a fire drill for your immune system. The immune cells need to be activated as if there was a real fire, and the reactions that people feel are the result of the immune system going into battle mode. In the Pfizer-BioNTech trial, the most common side effect was pain on the injection site, which was reported by about 84% of the participants. But this isn't unusual. We get pain when we are injected for other things. This was followed by fatigue, 63%, headache, 55%, muscle pain, 38%, and chills by 32% of the people. Now, these side effects all went away after a day or two, and these are all common side effects to many other vaccines, so they are not new or unique here. Question 5. Very important question because it's been asked by a lot of people, and there's a lot of misinformation being spread about this. And the question is, can the mRNA vaccines change our DNA? Let me make this very clear. This is complete nonsense. People who are spreading this are either incredibly ignorant or are being deliberately malicious. mRNA is not the same as DNA, and it cannot access our DNA to change our genetic code. I'll give you an example. Using mRNA in a vaccine is like sending a carrier pigeon into a military headquarters with special instructions on how to defeat an enemy. Now, can the pigeon just turn into a human being and take over the military headquarters? Of course not. Furthermore, mRNA is very fragile and is very quickly degraded once it's inside the body. And that's one of the reasons why these vaccines must be kept at a very low temperatures and why there needs to be 2 doses. Once injected, the mRNA transmit the information into the cells and it breaks down in the body after 48 to 72 hours. In fact, the mRNA vaccines produce fewer side effects than other vaccine platforms because they don't introduce any truly foreign viral material. They're using versions of substances that are part of an everyday cellular process. So the next time you receive a message with this nonsensical claim, please tell the sender to get a clue and delete the message and do not pass it on. Question 6. Why should we get vaccinated when there are almost no community cases in Singapore? And the answer is because we are currently safe, but we are living in an artificial bubble that cannot be sustained. We are like people living in a walled compound cut off from the rest of the world, and there are infected zombies outside the compound. We cannot keep living inside this bubble. Singapore is a tiny country with no natural resources, and we are dependent on having open borders, tourism, trade, foreign investment, business travelers, expositions, exhibitions, etc. to survive. If you're not aware of this and you think we can keep our borders closed, you probably failed geography, history, economics, and were probably a very bad student. So no, we must reopen the economy and our borders soon, and the vaccine will protect us from turning into zombies if we get bitten. Question 7. After getting vaccinated, do we still need to wear masks and practice social distancing? Well, the answer is yes. We all still need to wear masks and observe the social distancing rules when out in public, even after getting vaccinated. Why? Because the vaccine is just one part of the equation. A very important part, but still just one part. Think of the vaccine as a guard dog in your house, which will protect you and attack any invaders that enter your house. But as important as the guard dog is, you still need to have a front door, which is the mask, to minimize the chances of someone coming in. Now, although it has been proven that vaccines are very effective at preventing you from getting sick, it's not been studied yet whether those who are vaccinated can still spread the virus if they get infected. So you get the infection, but you don't get sick because of the vaccine, but you could still possibly pass the virus you could be an asymptomatic carrier and pass the virus to somebody else until your body kills the virus off. So there's a period there when you are actually able to pass the virus on to someone else. The vaccine will protect you from getting ill and ending up hospitalized, but it's possible you could still carry the virus and be contagious to others. And not everyone will be vaccinated, so there will still be many people who are susceptible to the virus and who will get sick if people are not wearing masks. So those who get the vaccine should still be wearing masks and practicing social distancing. You know, the modern vaccine age has been around for over 200 years. And over that time, vaccines have saved millions of lives from the world's most dreaded diseases, including smallpox, polio, diphtheria, tuberculosis, hepatitis, and many more. Diseases that killed and maimed millions of people, mostly children, have been tamed and minimized because of vaccines. This is indisputable science. And it's especially troubling that today, at a time when we have more information available at our fingertips than ever before in history, we are also facing an epidemic of anti-vaccination, anti-science, misinformation, ignorance, and plain stupidity, all of which threatens the lives and health of millions. So please do not believe any misinformation and false news you may receive on social media. The internet and WhatsApp chat groups are infested with them, and too many people mindlessly share them without even bothering to fact check. As a health journalist, I am truly appalled at how many lies, distortions, and totally false information is packed into anti-vaccination videos and articles. Vaccines work and save lives. That's the bottom line. When your turn comes, get vaccinated. That's it for this episode of Healthzone with Gilbert Cheah. Thank you for joining me. Please do like and subscribe, and do submit questions and thoughts that you might have about this, and share this with your friends and family because it is so important. And join us next week for another episode of Healthzone. Thanks very much.